women, especially women who have a family history, you should start 10 years prior to when that diagnosis was made. And there are ways that we can assess a woman's personal risk using different calculators that I use in my office.
Tell me more.
That take a lot of things into account. So when it comes to breast cancer, there's so many different risk factors that come into play. And women, being women, we want to know the reason for things.
Yeah.
And when a woman is diagnosed, especially a young woman who's healthy, it's not uncommon for me to sit and hear a woman tell me, but I eat well, I exercise, I've never smoked a cigarette, no one in my family has breast cancer, why did this happen?
Yeah.
And the truth is, I can never give them the answer of why that happens. It's just a combination of environmental, biologic, and maybe some genetic components that we just don't even know exist yet at work, at play. But we do have a way of inputting that information into these calculators, and it can give us an estimated risk of a diagnosis of breast cancer through your life. So things that you put in there are the age you started your period, when you started menopause, if you've had children, at what age you've had those children, the density of your breasts, have you ever had biopsies in the past, what is your family history, things like that. And those are the things that are put in, and it spits out a number.
Yeah.
And anyone who has more than a 20% lifetime risk, the general population, someone with normal risk, is about a 12% lifetime risk. Anybody with a 20 or greater percent lifetime risk is considered high risk.
Yeah.
So what does that mean? Depending on the level of risk, it means that we're at least watching you a little bit differently. And those women qualify for a yearly MRI, which has become a little bit questionable. There's some question in the literature about whether or not the gadolinium dye can cause issues. But there's no hard evidence to say that it does. But for women who are concerned about that, we spread their MRI maybe every other year.
Yeah.
And they're still getting the benefit of that really sensitive test. So the short of it is, if we know there's an increased risk, we have to watch women more closely, because our best friend in any cancer, but certainly in breast cancer, is early detection. The earlier we detect a breast cancer, the higher the rate of cure, the less amount of therapy they need. Oftentimes they wouldn't need chemotherapy, smaller surgeries. So it's just a benefit all around to catch things early by screening appropriately.
Mm-mm. Yes. Let's talk a little bit about LCIS. As you know, I have a ton of questions about it. I was diagnosed with it in December, November, had a lumpectomy, and was then, it was suggested that I saw an oncologist, and they recommended tamoxifen. The prophylactic double mastectomy was always in the conversation, not necessarily this is what you should do, but just this is one of the lines of treatment you can go for. And supervision every 6 months is the other one. I'm not on tamoxifen. I'm still very confused about the whole process. And I understand it's not cancer, and I feel lucky because of that. I do, though, feel confused and conflicted about the fact that, not being cancer, I still have the treatments, the options that women with breast cancer have ahead of me. Some of them highly invasive, right? Therefore, I would like if you could talk a little bit to us about LCIS.
LCIS, right. So LCIS has changed through the years, even while I've been in medical school and training. It used to be considered a precancer, and we used to treat it very differently than we do now. Now LCIS, which is sometimes confused with DCIS. So let's just talk about what LCIS is. So LCIS is lobular carcinoma in situ. DCIS is ductal carcinoma in situ. So the lobules are what the glands in the breast that make milk, and the ducts are the tubes that connect those glands to the nipple. So that's the difference of just where they start. So LCIS is not considered a precancer. It's considered now a marker of increased risk for making a cancer in the future. So, which can be a little confusing, mostly just because of the nomenclature, because they have the word carcinoma in it. That being said, just as you said, we offer a lot of the same things that a woman with a diagnosis of cancer would be offered for something that isn't cancer. And that confuses a lot of women, understandably so. There's a fly. Understandably so. It kind of circles back to what we were talking about before. It circles back to being able to identify women who are of higher risk and changing the way that we treat those women to avoid having a catastrophic cancer down the line that we can't do much for. So when I plug in somebody who has LCIS into those calculators that I was talking about, it usually comes up to be around 40%, give or take, right?
It's what
Yeah.
That's what I have.
So given that, we have to measure, right, the risks and the benefits. There's still a 60% chance that you won't make a breast cancer, right? So for a lot of women who are offered a prophylactic mastectomy for something they have a 60% chance of not doing seems a lot, right? The tamoxifen is offered because we know that women who take tamoxifen, when we look retrospectively back at all the women who have had LCIS, and we compared the women who took tamoxifen and who didn't, the women who did take tamoxifen had about half of the rate of cancer diagnosis than the women who did not. Okay, so that's a pretty big benefit. That being said, it comes along oftentimes with a lot of unwanted side effects, especially for younger women. Hot flashes, vaginal dryness, some women experience hair loss, things of that nature. Some women experience nothing.
Yeah.
So what I tell my patients oftentimes is that if they're open to it, because it's such a benefit, it's 50%, it's a lot. It's not like 10%. It halves your risk, is to try it, because trying it doesn't marry you to it. If you're having a lot of the side effects that are unwanted, then we retract and, figure it out. Or there are a lot of things that are now offered to kind of counter those things. So if one of my patients tries tamoxifen and they're having a lot of hot flashes, I've been offering that product I talked about from Bonafide earlier, and I'm not connected to Bonafide in any way. It's just worked for my patients. It's totally natural. And I would say 80% of my patients no longer have hot flashes.
Okay.
So, it becomes a balance of what we're willing to deal with and the risk that we incur, right? Does that make sense?
Yes.
And everybody's different. Everybody has their own view of what they're willing to deal with. Some women would say that's too much risk and would opt for a prophylactic mastectomy because they don't want the anxiety really that comes along with having to be monitored every 6 months and possible biopsies every so often and things like that. So it does become a personal choice, and it requires a lot of discussion between you and your doctor to come to something that makes sense for you. Because at the end of the day, everybody, no matter what the diagnosis, has sovereignty over their body and has to be the final decision maker in what the treatment's going to be. So I see it as my job to give my patient all the information and then to support them in the decision that they make.
Yeah, it is complicated.
It's complicated.
I have 2 follow-up questions. Let's see. One has to do with tamoxifen. So you take it for 5 years, I believe. Yeah. Is there an increased risk again after the 5 years? So does the percentage of 50?
That's a great question. So do you take it for 5 years and then after 5 years, do you go back to your risk? No. Oh. So the 5 years that you take it, the benefit is seen throughout your life. There was some, quite recently, there was question about whether or not taking tamoxifen for 10 years had a benefit. And I think that the data shook out from that to not really make much of a difference. Sometimes women who are very young when they're diagnosed, that are on it. I do see oncologists keep them on for the 10 years because somebody who's diagnosed that long, we just want that little added cushion. But the 5 years protects you forever.
Oh, that I did not. That's good news.
That's good news. Yeah, I tell people it's your 5-year boob vitamin.
Oh my God. I mean, yeah, yeah, okay, I see.